Hello and welcome. Today we're diving into the world of ophthalmology to explore a common yet often misunderstood condition, the conjunctival cyst. We'll uncover what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started on this journey to understand conjunctival cysts. What exactly causes these cysts to form? The etiology of conjunctival cysts is varied. Some are congenital, meaning they're present at birth, often due to trapped lymphatic tissue. Others are acquired, developing later in life. Common causes of acquired conjunctival cysts include trauma to the eye, previous eye surgery, chronic inflammation of the conjunctiva, or even blockage of the conjunctival glands, particularly goblet cells which produce mucin, an important component of the tear film. To understand conjunctival cysts, let's delve into the pathophysiology. Generally, these cysts arise due to a disruption in the normal fluid dynamics of the conjunctiva. Congenital cysts occur when lymphatic channels or conjunctival tissue fail to develop properly during fetal development, leading to fluid accumulation, a sac-like structure. Acquired cysts, on the other hand, typically involve the obstruction of conjunctival ducts or glands. This obstruction prevents the normal outflow of fluid, causing it to collect and form a cyst. Inflammatory processes and trauma can also lead to the formation of cysts by damaging conjunctival tissues and disrupting fluid drainage pathways. Conjunctival cysts are relatively common, affecting people of all ages and ethnicities. However, precise epidemiological data is limited. They are more frequently seen in individuals with a history of eye trauma, prior ocular surgery, or chronic conjunctivitis. While not typically associated with any specific systemic diseases, certain populations with increased exposure to environmental irritants or allergens may be at a higher risk of developing conjunctival cysts due to chronic inflammation. Overall, the prevalence of these cysts is likely underestimated due to the fact that many are small and asymptomatic, therefore not requiring medical attention. So, how do you know if you have a conjunctival cyst? The signs and symptoms can vary. Often, small cysts are asymptomatic and discovered during routine eye exams. Larger cysts, however, can cause a range of issues. You might experience a visible, fluid-filled bump on the conjunctiva, the clear membrane covering the white part of your eye. This bump can cause a foreign body sensation, like something is in your eye. In some cases, it can lead to irritation, redness, excessive tearing, or even blurred vision if the cyst is large enough to distort the corneal surface. Some people might also experience mild discomfort or itching. Diagnosing a conjunctival cyst typically involves a thorough eye examination by an ophthalmologist or optometrist. The doctor will carefully examine the conjunctiva to identify the presence, size, and location of the cyst. They may use a slit lamp, a special microscope with a bright light, to get a magnified view of the eye. In most cases, the diagnosis can be made based on the clinical appearance of the cyst. However, in rare instances, particularly if the cyst is atypical in appearance, or there is concern about underlying pathology, a biopsy might be performed to rule out other conditions. Conjunctival cysts can be classified based on their etiology and location. We've already touched on the distinction between congenital and acquired cysts. They can also be classified based on their content as either lymphatic cysts containing clear fluid similar to lymph, or inclusion cysts containing cellular debris and mucin. Furthermore, cysts can be described based on their location on the conjunctiva, such as bulbar conjunctival cysts, located on the conjunctiva covering the eyeball, or fornical conjunctival cysts, located in the conjunctival folds. This classification is important as it may influence the treatment approach. The treatment and management of conjunctival cysts depend on the size, symptoms, and cause of the cyst. Small, asymptomatic cysts often require no treatment and are simply monitored. If the cyst is causing discomfort, irritation, or visual disturbances, several treatment options are available. These include simple observation, which involves regular check-ups to monitor the cyst's growth. For symptomatic cysts, options include needle aspiration to drain the fluid, surgical excision to remove the cyst entirely, or cryotherapy to freeze and destroy the cyst. Topical medications, such as lubricating eye drops, can help alleviate symptoms like dryness and irritation. The best approach will be determined by your eye care professional based on your individual circumstances. While it's not always possible to prevent conjunctival cysts, there are steps you can take to minimize your risk. Protecting your eyes from trauma by wearing safety glasses during activities that could cause injury is crucial. Properly managing any underlying inflammatory eye conditions, like conjunctivitis, can also help. Maintaining good hygiene and avoiding rubbing your eyes can reduce the risk of infection and irritation. Regular eye exams are also important for early detection and management of any potential eye problems, including conjunctival cysts. The prognosis for conjunctival cysts is generally excellent. Most cysts are benign and do not pose a threat to vision. While recurrence is possible after treatment, it is usually manageable with further intervention. Regarding recent research and advances, there is ongoing investigation into less invasive treatment options for conjunctival cysts, such as the use of topical medications to reduce inflammation and promote cyst resolution. Further research is also focusing on understanding the genetic factors that may contribute to the development of congenital conjunctival cysts. By staying informed about the latest advancements, we can continue to improve the diagnosis and treatment of these common eye conditions. Thank you for joining us on this exploration of conjunctival cysts.